Individuals who are dealing with prostate cancer treatment or recovering from those treatments may face a wide array of challenges. We continue to gain more knowledge and tools in helping cancer survivors live their lives to the fullest. Today, we'll be discussing how we can better deal with these challenges with cancer survivorship expert, Dr. Arash Asher, who is leading an emerging movement in cancer care. So stick around. The show today is brought to you by our sponsor, the Prostate Health Academy. The Prostate Health Academy is launching soon, and this is exciting news. The Academy will be an essential community for individuals wanting to learn more about prostate conditions, connect with like-minded individuals, and improve their overall health. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is the question, and this podcast will provide the answers. On a weekly basis, we will be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pullman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. We are very happy to be able to introduce the Prostate Health Podcast today, Dr. Arash Asher. He is the Director of Cancer Survivorship and Rehabilitation at the Samuel Oschin Comprehensive Cancer Institute at Cedars-Sinai. Dr. Asher completed a physical medicine and rehabilitation residency at UCLA and a cancer rehabilitation fellowship at MD Anderson Cancer Center in Houston, Texas. He is board certified by the American Board of Physical Medicine and Rehabilitation, as well as Hospice and Palliative Medicine. Dr. Asher is leading an emerging movement in cancer care. He runs a dynamic clinic for patients and survivors. His clinic supports patients and survivors facing a wide range of challenges such as fatigue, weakness, changes in thinking, and pain. In pursuit of that goal, Dr. Asher has integrated a number of innovative cancer rehabilitation programs, including art therapy, personalized exercise programs, and novel cognitive rehabilitation. Dr. Asher, welcome to the Prostate Health Podcast.
Thank you very much. I appreciate the opportunity to be here.
Well, Dr. Asher, in your practice, what are some of the challenges that an individual may potentially face with the diagnosis of cancer?
One of the reasons I was drawn to cancer survivorship care is the comprehensive holistic aspect of it. So I really think about the physical aspects of going through a cancer diagnosis and the spiritual, psychological, emotional piece. And I think they're equally important. Obviously, each person may have their own journey and what they may have to contend with, but I think it's important to pay attention to both arenas.
So one of your programs called GRACE, or Growing Resiliency and Courage at Cedars-Sinai, has been an outstanding resource for those dealing with cancer. Would you tell our listeners a bit about what this program entails?
Sure. I'll just start by framing how we started this with my colleagues at Cedars-Sinai. I would often be in my own clinic contending with the physical aspects of a cancer diagnosis that many of our patients have to reconcile, which is, as you know, things like fatigue or muscle weakness or sometimes neuropathy or other just physical side effects. And as I'd be in the clinic, I realized, we really weren't addressing the existential piece that many people have to wrestle with, which is, the why me or facing the aspect of our mortality or dealing with fear, either whether it's fear of recurrence or fear of the unknown. And I knew a 15, 30-minute clinic visit wasn't enough time and space to address these issues. So over time, we developed this GRACE program, which is 6 weeks long, where we basically developed a curriculum where we try to address how do we actually cope with the spiritual, existential, psychological piece of a cancer diagnosis. And that's really where it stemmed from.
Yeah, well, that's great. And during that, so it's a 6-week program. And then, once they've completed that program, do they have an opportunity to come back and reconnect with others? Or I guess there's probably different avenues there after they've completed the program.
And that was a learning curve for us. We really designed the program not to be a support group. I'm not against support groups, but there are many places, I think, around the country, around the world, where people could attend support groups where you just kind of process and express your feelings. This was more of a educational type program where you're learning tools. But even though it wasn't a support group, we realized, our participants really did gel and bond to each other, to us, to the ideas embraced in the program, and they didn't necessarily want it to end. So what we started to do is every month or two, we would do a reunion where we would bring in either a guest speaker, or we would just revisit a topic from a different angle. We'd introduce some new science that was kind of described in the medical literature as a way to connect and to keep hopefully growing and learning as a community.
Yeah. Well, definitely such a great resource you have there for your population and your patients. And certainly a program that other institutes can learn from, and hopefully, take that same model and hopefully implement similar programs across the country.
And I'll just mention, we're actually working on creating a web-based platform for this program so that we can disseminate it more easily. Because at the end of the day, if we're only supporting 10, 15, 20 patients at a time in our little micro community, which is fine, I think that still makes a little difference, but we would love to share this more broadly for those that might benefit in kind of learning some of the dimensions of the program.
Yeah, well, that would be great. And certainly keep us posted when that is up and live, and we could certainly share that with our listeners, definitely. So a common term used by cancer survivors is the term chemo brain. So what is chemo brain?
I appreciate you bringing that up because, as you know, the medical world no longer loves that word, because I'm sure you have many patients that never even had chemotherapy, but still struggle with some cognitive side effects. There's a word on the tip of your tongue, you can't get the word out. You don't remember names or phone numbers, or people often describe this idea that I used to multitask and do 2 or 3 things at once, and that's much more challenging than it used to be. And so the preferred term now, as you may realize, is cancer-related cognitive impairment. And what that term allows for is the idea that it could be chemo for those that had it. It could be anti-testosterone drugs, for example, for our individuals with prostate cancer, or anti-estrogen drugs for those with breast cancer, for example, or the stress or the mood, the anxiety, the symptoms of depression, the loss of sleep, all these other variables that we have to think about when we want to optimize cognitive performance. But whatever the cause may be, I think it's important to shed light on the issue that it is a common concern for many of our patients. And I think much more needs to be done to try to, again, optimize cognitive resiliency as best as we can.
We're going to take a quick break here with a word from our sponsor, and we'll be right back. There is some exciting news coming with the Prostate Health Academy. The launch is just around the corner, where we'll be opening the doors to the Academy. This will be an essential community for individuals wanting to dive in even deeper and learn more about the various technologies available to them for prostate conditions. In the Academy, you will be able to interact with like-minded individuals in the private community forum and have access to exclusive bonus podcast after-hours video content with experts, innovators, and leaders in the field. We'll also be keeping up with the latest evidence on a prostate-healthy diet and exercise, and creating a roadmap for you to keep you on track. For those that don't want to miss out, you can sign up for the waitlist at www.prostatehealthacademy.com. Now, have you, found any particular methods or treatments that you found helpful in dealing with this kind of cognitive impairment, or is it kind of really patient or situation specific?
It probably is patient and situation specific, but there are common themes that once we've ruled out, making sure that no one's, someone's thyroid issue is okay and you're not anemic, and medical factors that can contribute to cognitive performance have been addressed, then there's still this common pool of symptoms that people have to contend with. And we developed a program for that as well. As you know, I'm keen on group type programs because I think it's an efficient way to get people connected and really delve into meaningful strategies. But some of the basic ideas that just across the board we've found helpful, that if our patient is experiencing depression, which is not the same as chemo brain, but there's a fair amount of overlap, to treat that, whether it's medications or therapy or other alternative strategies. We're learning, and it's early, but we're learning that exercise, aerobic exercise, not necessarily brain exercises. And I know people often want to play Sudoku and crossword puzzles, which I'm not against, but you can play Sudoku all day long and you'll probably get better at Sudoku. It won't necessarily translate to the challenges that our patients experience, but aerobic exercise seems to have much more compelling evidence that it can improve some of the cognitive symptoms that have been described. Optimizing sleep. And I know these are the basic things, making sure you're getting good quality sleep, adequate nutrition, and learning to manage the stressors. That's a big part of the program. How do we manage distress and stress? And because when we're going through a lot of anxiety and distress, what we often don't realize is there's so much of our mental resources being directed to that it competes for our attention. And attention is a critical part of memory. And that's why, and this is another part of the program, you may be aware of mindfulness-based stress reduction programs being helpful for cognitive improvement. And one of the reasons for that is mindfulness seems to improve our ability to attend, to focus, to be in the present moment. And so there are all these strategies out there. Our goal with the Emerging from the Haze program is to collect it together, bring it together so that our patients can kind of have a streamlined way of learning these strategies.
Yeah. Well, again, another great resource that you have there. And like you said, if that would definitely be another one where, if there was kind of an online, access to that, to our listeners, to, people around the country, I think that would be a great program for a lot of the cancer survivors out there.
Let's be in touch about that. Thank you, because we're actually recording end of August. So it's it's the first time we've done this. So we're starting with the Haze program. We're going to record it and make it available hopefully later this year.
That's awesome. So your group at Cedars-Sinai has also been active in offering yoga programs to your cancer patients. Can you share a bit with our listeners how yoga may help benefit someone who has underwent or maybe is still undergoing cancer treatment?
There are many great benefits to yoga for people going through treatment. One of the things I love about it is particularly when you have a trained instructor that understands the cancer journey, it's very gentle. I mean, with the exception of doing neck stands in a community program for someone that, has, bone metastases to the neck, which I saw once, which almost gave me a heart attack. Generally speaking, it's very gentle and safe for virtually everyone. It integrates some of the breathing techniques and mindfulness strategies generally. And we know it can reduce the stress hormones. And we think the inflammatory cytokines that are for some cancer types associated with either the progression or metastases of certain cancer types. And so things like yoga or Tai Chi or Qigong, which encompasses the mind-body type interventions, seems not only to be helpful because it offers some physical exercise, but because it reduces the stress response, it may have biological benefits. And obviously a lot more work is being done in this area.
Yeah. We'll kind of circle back around to, I know we touched on exercise a bit and speaking with the benefits from a cognitive standpoint. And what would you just say overall are some of the other benefits for cancer patients and survivors with exercise?
So we've known for some time that it can help with fatigue. And of course, fatigue is one of the most common symptoms that our patients experience. And that may be motivating to some, but I think what is really compelling, which is an evolving science, is the idea that exercise is probably going to improve survival for multiple cancer types. And of course, as you know, prostate cancer being one of them. Yeah. There are, large scale randomized clinical trials underway, for example, for metastatic prostate cancer. But again, because exercise, and the reasons for this are being explored, but because exercise seems to have anti-inflammatory properties. So when you contract your muscles, like when you squat, when you jump, when you swim, when you ride a bike, and you contract your muscles, we're learning that your muscles produce these chemicals which have been dubbed myokines. And these myokines, it's fascinating, it seems to reduce what's called our inflammatory cytokines. So it seems to have this process by which it can help change the environment around a tumor to basically have some anti-cancer properties, so to speak. So if the fatigue and helping with the depression and the anxiety and the sleep is not compelling enough, the idea that it very well may improve one's survival should be. So I hope our listeners remember that, because I think it's really important in an evolving area of the science.
This has really been very powerful information so far, and I know we are running out of time today here on the podcast. Dr. Asher was kind enough to stick around to chat a bit longer for the Prostate Health Academy. We'll be going into further detail into another additional useful program, Cancer Survivorship Through Art, and how it is benefiting cancer survivors. We'll also dive a bit deeper into the how for the yoga program and what an individual can do to begin implementing this. This will be available inside the upcoming Prostate Health Academy. For those that don't want to miss out on this opportunity, make sure you sign up for the wait list at www.prostatehealthacademy.com. Well, this has all been outstanding information, and I know we could go on for hours talking about some of these awesome programs that you have. So, Dr. Asher, any final thoughts today for our podcast listeners?
I would just say it's important to keep setting goals. So I know from many of our patients, when they go through something like this, it feels like life stops, and it's understandably overwhelming. But I want to encourage everyone to keep setting goals and building towards those goals. And obviously, I'm biased as a survivorship rehabilitation person, but I think it's important to remember that it's important to still pay attention to the social aspects of our lives, to staying connected to our loved ones, to trying to keep our physical body fit, to eating well, sleeping well, exercising, because not only do those things improve our quality of life, but increasingly we're finding that it probably impacts the tumor biology. And so for all these reasons, I would pay attention to the holistic experience because it's important.
Well, Dr. Asher, it was indeed a pleasure having you on the show today. You've really provided significant value for our listeners, and thank you again for taking time to join us.
My pleasure. Thanks so much.
Thank you again for listening to the Prostate Health Podcast. We would love to have you join our podcast Facebook group at www.facebook.com/groups/Prostate Health Podcast, or just use the Facebook group search function and search for the Prostate Health Podcast and ask to join. We'll see you at the next episode.